Thank you very much. I'm speaking today as the CEO of Strongest Families Institute, but I also have other jobs because I don't get paid for that job. I'm the VP Research and Innovation at the IWK Health Center, and I'm a Canada Research Chair and Professor of Science, Pediatric Psychiatry, Community Health, and Epidemiology at Dalhousie University. The speakers this morning have mostly come from Nova Scotia. I think that reflects the fact that we are, like Quebec City, a fabulous place to innovate and to learn. I'd like to invite you all to come and visit and come and stay with us and work with us. The problem that we started with was the problem of mental health problems in kids. I'm a clinical child psychologist by training. These problems begin early. They're common. They're costly to families, individuals, and societies. There's poor access to care, and the incidental costs for free care in the Canadian system, where you have a publicly funded healthcare system, are actually quite high. You can cost you $1,000 to have a course of personal money to have a course of treatment easily, because you have to take time off work, you have to travel, you have to pay parking, you have to pay for babysitters, you have to pay for meals. All of those costs are not, these incidental costs are hidden costs to patients that nobody ever looks at. There's long wait lists for services. There's very high dropout rates in mental health services. About 40 to 65% of families that begin child mental health services drop out. There's little quality control in mental health services. It's inefficient. It's expensive. It doesn't work all the time. The system is not patient or family friendly, and there's no system commitment to improving outcomes. There just isn't. Individuals have commitments to improving outcomes, but we don't even know what our outcomes are usually in child mental health. We just don't know. So innovation in healthcare, the health system is a key. I'm very pleased that people have noted that the health system itself is a key element in innovation. It's the only place that science is actually brought to patients. A patient and family-oriented system focused on evidence could really disrupt the status quo. Medicines, molecules, tests are very important, but the processes by which we deliver healthcare are also extremely important. There's little accountability for best practices, and there's really very little incentive to innovate. I spend my days in the hospital. That's where I work, in 2 of the hospitals. And there's powerful interests in universities, businesses, and the health system to encourage the status quo. People make comfortable livings with the way things are now. And we have to recognize that the status quo is just not good enough. We need the catastrophes that were spoken of. We need things to fall apart or virtually fall apart before we will really innovate, because it's too easy now. It's too easy to go on doing exactly the same things that we've always done, with new drugs and new little things here, new tests, yes, but really changing the processes in the system. The mental health system is ripe for changes, because as the Kirby report, Out of the Shadows at Last, said, it's not a system, it's a catastrophe, it's broken. Go back and read that report and see how bad the mental health system is. There's many very good, talented professionals. But there's fierce opposition to improvement. Clinicians, basically, as a bureaucrat, I see this all the time. The clinicians say, well, give me more money. That's how we solve a problem. Give us more resources. Give us more people. If you give us 12 more or 24 more of this, we'll solve the waiting list problems. The bureaucrats always scratch their heads and say, the professionals are impossible to manage. They're not focused on efficiency. They're not focused on getting things done. It's a very provider-oriented system, and new models of care are sharply resisted. The goals of our Strongest Families program was to increase access to services, early intervention, and processed very quickly, to reduce dropout rates, to embrace quality control, to make the system effective and efficient, to focus on families, make it convenient for families. Imagine if the healthcare system were focused on the families. Every professional says, we focus on the patients. But in fact, if you look at the practices, it's not that way. We devised a system where help was received at home, outcome and customer satisfaction was driven, it was scalable, and it was to serve the health system. So Strongest Families is now a not-for-profit institute. This is one of our handbooks for parenting the active child. We do both handbooks and telephone, but we also have developed interactive website delivery, and that's where we're moving very quickly. As the access to the internet increases, especially among the poor are certainly in mental health, twice as likely to have mental health problems as the well-off. So if you devise a system that doesn't reach the poor, you're not serving the population. And one on Chase Worries, we focused particularly on the two most common problems in child mental health: anxiety, it was the most common problem, but not the one that is most commonly brought to care, and that is disruptive behavior. Disruptive behavior includes opposition defiant disorder, you can figure out what that is, and attention deficit disorder. So we use a curriculum and coaches. Our coaches work until 2 o'clock in the morning because from Halifax we serve families across Canada. And they're bright, capable, personable. They demonstrate excellent communication skills. They're attuned to treatment and risk management protocols. They reinforce the skills that are learned. They problem solve with the family. They encourage and support family, and they collect data. They're highly productive and highly motivated. They have at least 30 cases on a one-to-one basis at any one time, 90 to 100 cases treated per annum, 180 cases per annum when we use group-based interventions. We have both males and females because we want to have males in there because we want to reach fathers. We haven't been very good at reaching fathers. Nobody has. 95% of mental health care parenting is given to mothers, but fathers are important, and we hope to correct that. They're very happy staff. We don't have a large turnover. Most of them we have turnover when they wander off to medical school or to graduate school in clinical psychology. The facilitators to success is we used integrated knowledge translation. We involved key decision makers and clinicians right at the beginning. We wanted to make Strongest Families usable in the real world care, efficient, effective, and scalable. It met a high priority need. The service is a catastrophe. That was an advantage to moving into this. Excellent relationships with the healthcare system. We hired well, helped some people move on. Sometimes people are not suited for this type of work. Harness the advantages of technology and embrace the changes for ongoing improvement. We're committed to meeting the needs of families, customer satisfaction. My president is paid on the basis of outcomes. She is paid partially on the basis of the outcomes of our families and the customer satisfaction. Her bonuses, which are about a third of her salary, are paid on that basis. We had excellent leadership. Trish Potty is the president and chief operating officer, and she does all the work. She's a PhD nurse, and she did her dissertation on our topic in my lab. And the senior coaches have been with us for years. We actually now have senior coaches because we're a distance program. We actually embrace that, and we have coaches in Newfoundland, and because they moved away and we wanted to keep them, so they had to move for family reasons, so we have coaches in Newfoundland, we have coaches other places. It's data-driven, skills, information, and support. The key decisions that we had to make was within the system or a vendor to the system. We had to decide whether to sell a product or sell a service. We decided to sell a service. Would we be a for-profit or not-for-profit? It's a thing in Canada that if you're for-profit and you deliver healthcare, the only conversation, the only narrative is about the fact that you're for-profit. And we're, of course, science-based, based on evidence all the time. The barriers of success it's the novelty. You mean you'll never see your patients and the only people who will talk to them are your coaches who don't know anything? selling services rather than a product. It's simple. People think, well, just give me the manuals and I'll do it. It won't work that way. Can't raise capital because we're not for profit, and it's extraordinarily hard to sell to government. It takes a long time to sell a product to government, but they do pay their bills. So I want to thank the CIHR, which has been very generous in supporting us, the IWK Health Center, which is where we were based, and the Dalhousie University, where my academic appointment is, and they've all been very supportive of our work. Thank you very much.